Well, I found out I had scoliosis like 2007, but the physician I saw said, you don't want surgery and I don't want to do it. So everything kind of went on the back burner. Didn't even think any more about it. And then I was supposed to go back and see him, I don't remember if it was 6 months or a year, but I was having so much pain, which got worse. I didn't do anything about it for years. And then I started having more lumbar problems, and I went to see a pain clinic, which was good. And they did epidurals on me. She said, well, you need to have like scans or whatever every year to see if this is progressing, your scoliosis series. So I did, and yeah, it was bad. It was 40-some or 50-some degree curvature.
The reason why adult patients are not advised to treat their scoliosis in the adult form, because a lot of doctors think that curves don't worsen in the adult form. They kind of they stay where they are. In fact, this is some kind of like a old tale that, and once you're not growing, curves don't worsen. And we know this is completely untrue. Curves worsen in the adult form. They just worsen very slowly over years, if not decades, and then they snowball. And as you get older, they start progressing faster and start accelerating themselves. So an untreated curve in the adult form more than likely will worsen. We can't tell you the exact rate of your worsening because depending on the size of the curve, your activity levels, your age, and those forth, but we will see worsening over time and increased rate of worsening as you get older.
I'd continue to have the epidurals, and I'd get that every year. And then for some reason, it popped up that this place was here. And so we started to research that. And lots of good reviews, and we decided to come and we tried it. So last November was my first time, and I was here for 2 weeks. And my sister and her husband's like, oh my God, you look so much better. Yeah. So, I was real pleased with it. Well, the progression, we wanted to slow the progression because, it's just getting worse and worse. And then, that affects all your other organs. And they told me I needed a lung scan to make sure that I was breathing okay. And then I needed like the colonoscopy and all that stuff because it affects your colon and everything too, and had all that done.
Now, what's interesting with Gale is that her scoliosis is more of a lumbar scoliosis, and she doesn't have a really significant thoracic scoliosis, but she's complaining of some lung impairment and some breathing issues. So therefore, this could potentially be occurring not because the curve is actually pressing on something, but because the spine is actually compressing down because of gravity over time. And this leads to a more rigid spine, which can make it harder for the spine to expand when the patient breathes. So as we improve the flexibility and reduce the size of the curve, we're hoping that we can resolve these limitations that Gale's experiencing.
Unless you're aggressive with it, I don't think, you're not going to get any good results. And you have to do what they tell you to do. Really, I don't have much pain at all right now. Sometimes I'll have some back pain, lower back, but I think that's because of all that I do. I haven't slowed down in what I do. It just makes it more difficult if you have the brace on because it limits you in what you can do, even though I still try to do it. And I think that's the problem. But other than that, I'm not having any discomfort. Nope, there's no pain like I had before. The fact that I am glad that I found this place and that I come because I feel like it has helped me. Yeah, so I think other people, if they've got scoliosis, it's worth a try.